Vitamins or vitamins are those essential substances which are very much required to our body, but they cannot be synthesized in the body. And vitamin deficiency is a very common complaint which we all humans face in our day-to-day life. Why is this vitamin deficiency occurring? Yes, it is because obviously decrease intake, that is you eat less of vitamins which are required, or you're eating adequately but there is decreased absorption. So second is decreased absorption. The third is that you're eating adequately, it is getting more metabolized, that is more utilized in the body. And the fourth one is inadequate storage, that is in pregnancy or you have some illness like fever, your body cannot store vitamins and it just washes off. So in all these conditions, you can get vitamin deficiency. But why dentist is speaking about this? Yes, because all your vitamin deficiencies show changes in your mouth at the first speed. So come on, let us have a look at what deficiency can show what changes. Let us move towards the video. Hello and a very happy morning to all of you. Here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. Friends, today we are going to speak about vitamin deficiencies and how are and what are the oral changes. So the first vitamin deficiency that we are going to speak is most of the vegetarians have this. Yes, you guessed it right. It is vitamin B12 and the oral changes. Vitamin B12 is obtained from milk curd only for the vegetarians. Otherwise, it is obtained from mutton, beef, egg and fish also. Yes. So, if these are the sources of the vitamin B12, obviously vegetarians ought to have this deficiency. What are we supposed to do? The management part remains like we can have tablets or we can have directly intramuscular injections of vitamin B12. What are the changes that you can see when you have vitamin B12 deficiency? The changes are color, texture and size of the tongue mainly. So let me tell you what is normal. The normal color of the tongue is pink. And in vitamin B12 you will see the color is changed to pale white, or if there is inflammation, that is there is burning sensation, then it will be red in color. Then is the texture. If you normally even rub your tongue to the hard palate, then you will find your tongue is quite granular, rough on the upper surface. So in vitamin B12 deficiency, this rough surface, it changes to quite smooth and glossy kind of thing. Yes, then comes the size. The size is normal, it should fit inside your oral cavity, inside your teeth. That is the size of the tongue. But in vitamin B12, this size might just increase. There might be soreness. So in vitamin B12, there is red or pale color, there is smooth tongue, there is soreness, swollen tongue. This tongue also sometimes is ulcerated. It can also show glossitis and glossodynia, that is inflammation, redness in the tongue. Then there is burning and itching on the tongue. You hardly can eat anything. There is lot of hotness or lot of warmth that you can feel in your tongue. Also, along with the tongue, you can feel that the oral mucosa has got a few changes. Your lips, they become dark. They are, it is called as angular cheilitis, that is the angles of the lips, they become pinkish and cracked and it is difficult to open your mouth up. The lips also can show fissures and cracks, ulcerations, and yes, the lips turn out dark. So this was vitamin B12 showing oral changes, but you should also relate it not with only oral changes. In bodily, how vitamin deficiency can attack is you feel tired, there is lot of muscle pain that is there, then there is shortness and breath, difficult to breathe, then hair loss, big problem, yeah, and then there is difficulty in concentrating. So in children, if you have B12 deficiency, they will have difficulties during their studies. Concentrating during work also becomes difficult. Deficiencies are usually common in elderly people because you get higher risk of inadequate intake, and also your absorption capacities may just get hampered. Now moving to our second deficiency, that is deficiency of vitamin C. Yes, deficiency of vitamin C is also very commonly seen, and this deficiency does not really show any bodily symptoms, so rarely it is detected. Vitamin C is related to your gums health. So if you have inadequate intake of cabbage, guava, lemon, grapes, oranges. Yes, lemon, grapes, oranges are very much high in vitamin C. Then red cabbage, mangoes, pineapples, and all the sour fruits and vegetables that you get. Even green leafy vegetables have a lot of vitamin C in them. If you are inadequate somewhere, you're the source of vitamin C, then you have vitamin C deficiency. Now, in mild case of vitamin C, you will show a little bit of weakness, there is fatigue. But if there is severe or prolonged duration of vitamin C, then the most prominently seen symptom is in your oral cavity. That is called as scurvy. Yes, you must have all commonly heard this named as scurvy. What exactly is scurvy? So, as you can see it in the picture here, that between the two teeth is our interdental papilla, which is part of your gums. This pointed interdental papilla then becomes swollen, and whenever you touch it, it sometimes also becomes ulcerated. Whenever you touch it, it easily bleeds. This can be seen generally in whole of the mouth, or sometimes it can also be concentrated in one specific area. Yes, plaque and calculus are also one other reason for this bleeding of gums along with the scurvy. So, if you do not maintain good oral hygiene and have vitamin C deficiencies, you can easily get this scurvy, or what we call it as gingivitis and periodontitis. The most severe or the future of this can be, like if you leave it untreated, do not pay attention to it, it will lead to bone loss and your gum loss. And you know it, bone loss and gum loss means periodontitis. I have made a video on what exactly happens when the bone and gums go down. So here on the link you can click and watch that video. But in short, if I tell you, your teeth can start moving, you can see that there is increasing in the gap, and later on losing up of all teeth. So end stage, right? So take care of your vitamin C and have adequate intake in your diet. Coming to the vitamin A and D. These vitamins rarely do show any deficiencies, but if you do not have it in the correct quantity, then they will definitely have effect on your teeth. So as vitamin C is for gums, A and D is for your teeth. The enamel, the first coating of the teeth, is hampered if you do not have proper intake of your vitamin A and D. It can lead to a lot of caries and cavities. The shape of your teeth is not really appropriate. There might be ditching, undercuts, breakage of teeth is very common. So having a good intake of vitamin A and D is equally important. Now, a rare vitamin, vitamin K. Haven't you heard that before? Yes, vitamin K in our body is important for clotting mechanism. That is, whenever I get an injury, the blood stops oozing or stops flowing in after a specific point. Why is that so? Yes, along with the platelets, vitamin K is important for causing clotting or stagnation of the blood at the injury point. Similarly, in our body, if vitamin K is deficient, then there will be oozing of blood. And where can this oozing be first seen? Yes, my friends, you guessed it right. It can be seen from your gums. If you have very much severe bleeding, then I would say don't relate it to vitamin C, relate it to your vitamin K. So friends, here we end up the video of vitamin deficiencies and oral health and oral changes. If you have any other questions related to your diet or what are the oral changes if you do not take certain particular ingredients, certain essential substances, nutrients, then what can happen? Write it in the comment section below and I am here to answer it for you all. Friends, have a good and a healthy life. Exercise every day. Eat right and eat healthy. Junks are only good to taste, but they are not good for your health. So make sure you have right choice of what you are eating so that you can have a choice to live a good life. I wish you a very and a healthy life ahead. Stay healthy, stay positive, and be fit. Thank you.